Hello, everybody. Good evening, and welcome to the Functional Solution podcast, where we discuss about the root causes, approach, and how to restore your patient's health. My name is Tal, the Educational Director at the American Academy of Functional Health, and with us we have Dr. Chill.
Hi, everybody. Welcome.
And Dr. Chill is a functional medicine physician from San Diego, who is one of our leading coaches for the medical and the business side of functional medicine with years of clinical experience. So we're very honored and blessed to be here, all of us with you today. And it's a nice day here in Oregon. We can actually see the sky, which is actually see the clear blue sky, which is quite unusual for, I would say, middle of October. But we'll take it. You know, I'm not complaining by any means. I know that you're in San Diego, so it's probably sunny today, I'm guessing.
Actually, I think we switched weather because it's cloudy here today, and it looks like it's about to rain.
Oh,
we took some of that Portland, Oregon weather.
Yeah. We had those cloudy and a little bit of rain in the morning. So I think it's kind of switched to went down south to California. So so enjoy the rain.
We'll take it. We need it.
Yes. So in today's discussion, we got a very, very important topic, and that's the topic of rheumatoid arthritis. And there's multiple reasons why we choose this topic for today, but there are two or three things that I really want you to get out of today's discussion. One of them is a better understanding, or I would say a deeper understanding of what's triggering those genes of inflammation and arthritis. What's upregulating the expression of those genes of autoimmunity, and what can you do about it, right? What are some of the strategies, some of the natural solutions that you can offer to your patients? So just as a general overview, rheumatoid arthritis, we know that it's an autoimmune condition that mostly targets and affects the lining of the joints. It could eventually lead to destruction of other tissues in our body. But it is an autoimmune condition in which the immune system mistakenly targets the joint, the healthy cells of the joint, right? And it's a very common condition. It's according to the CDC, there's over 1.3 million people worldwide that are impacted by this specific condition. And it can start at any age, but it's most commonly between the age of 30 to 50 to get a diagnosis. And it's really interesting that many of these reports state that majority of the patients with RA are women. And according to Johns Hopkins Arthritis Center, the prevalence increases with age and reaches about 5% in women over the age of 55. So we know that there are multiple challenges with working with patients with rheumatoid arthritis, right? We know that one, the standard of care is focused on manage patients' conditions, right? The second is that many of those patients keep progressing and get worse and worse, despite the fact that they're taking those medications. And we've all seen those patients in our offices when they're coming in. And one of the patients that came to see us once, she was on multiple types of medication, and she was losing her ability to even bend her fingers, right? To flex her fingers, which was at some point, she couldn't even hold a cup of tea or water properly, right? So it's a terrible, terrible condition. And they know that the reason why we are in functional medicine, of course, we focus on understanding why the patient developed the disease and what needs to be done. What can we do to start restoring healthier function? Right now, there are multiple strategies that we're going to be talking about today. And many of our community members are coming from hospital care, primary care, They don't know much about functional medicine, while we also have some practitioners who are coming in and they already know about functional medicine. Maybe they took a few classes, or maybe they, they've been practicing, like Dr. Amandeep, a member of our community who's been practicing in functional and integrative medicine practitioner, but he wanted to get certified and really dive deep into have a better understanding of those dysfunctions. So to start with, why would we offer functional and nutritional medicine approach for this condition? So you might be thinking to yourself, well, I'm a primary care practitioner. Why would I also offer functional medicine for this specific condition, right? And there's three major reasons why all providers should have some understanding of this approach. One, it's because it's a terrible disease with chronic pain that leads to loss of function, disability. We've seen a lot of patients that have lost their ability to be employed, and loss of wages due to that. They cannot provide for their family. Even with drugs, many patients continue to lose function and struggle with pain. And just as a general statement, there was a survey that was done with chronic patients with the Harris poll survey, and they found that around 50% of patients, I think it was 54% of patients, said that they're dissatisfied with the current healthcare system, right? Could be for multiple reasons, but a lot of them keep struggling. The second reason is you want to offer functional medicine is because the drugs, RA drugs, have terrible side effects. That includes nausea, abdominal pain, vomiting, hair loss. There's a whole list of side effects. And according to a study published in the Journal of Rheumatology in 2022, out of 560 RA patients, 67% of them reported that the symptoms they experience side effects that bother them, right? So that's a lot of patients that have those side effects, right? 67% of those arthritic patients experience those side effects. So the way that we want to look at this condition is offer a different approach or a combined approach, right? Because a lot of those patients are taking medication, they struggle, and then guess what a lot of them do? They go home and they ask Dr. Google, what can I do for my arthritis, right? And so we would prefer you to be educated about the functional medicine approach to arthritis and other chronic conditions so you can provide the appropriate recommendation instead of patients going out there and trying different things that might not be based on evidence, clinical evidence, right? That is a lot of patients. On top of that, and that's number 3, RA is a very expensive disease to manage. Patients in multiple surveys that we looked at report spending well over $2,000 a month on medical necessities, right? So those medical necessities, for example, could be physical therapy, compressive wear, assistive devices, supplement, kinesiology tape, physical therapy, TENS units. I've seen patients spend money on different things. We had patients come in with infrared devices. We had patients come in with trying all sorts of stuff. And the biologic medication is really expensive, right? A lot of those medications they have an out-of-pocket of between 20 to 50%. So think about that. Patients with arthritis spend over $20,000 a year on average, just on trying to mitigate the pain, right? And most of it doesn't even address the root cause. And that's one of the reasons why when you have a better and better understanding about the root cause and offering the unique approach and solutions to actually modulate the immune system and figure out what's causing that immune disturbance, right? That leads to the chronic inflammation. That's what makes your services very, very, very valuable, right? And I'm saying that as a as somebody who's been in the healthcare field for almost 20 years, I'm saying that also as somebody who was a patient that had chronic inflammation and asthma and joint pain. I spent thousands of dollars, money that I didn't even have at the time when I was much, much younger. And I just tried, I was just feeling very, very hopeless when I was stuck with a chronic condition and the medication. One, I didn't want to get dependent on medication, and I was on steroids and I was on all sorts of stuff. And I just didn't feel good. I felt like I'm losing my health, right? And a lot of your patients are in that exact place. So that's few of the biggest reasons why looking into the root cause, when I did as a patient, at least for myself, it allowed me to resolve years of health issues that I had. And I still take care of myself, right? I'll take some supplements when I need it, but I can tell you that I have not used medications for years, right? And so we can help a lot of those patients. We've seen those transformations in our practice. Of course, we can help them to reduce the swelling. We can help improve range of motion. We can't magically reverse or cure the condition, right? That's not what we're talking about. But we're talking about really helping them to, one, prevent the progression of the disease as much as possible, and also improve their range of motion, less swelling, less pain, so they have better quality of life, right? So that's what we're going to do today. We're going to look into the root causes of rheumatoid arthritis, a couple of them. There's several root causes, but we're going to look at two of the major ones. And then we're going to look at a few natural solutions you can add or consider adding to your patients. This is where, of course, it's a big topic, and there's probably about a 2 to 3 hour class in our advanced functional medicine program just on rheumatoid arthritis, and then on other conditions such as osteoarthritis, and then there's different autoimmune conditions. But we wanted to provide you as much information so you can start utilizing that for your patients. So Dr. Chill, I'm sure you've seen a lot of rheumatoid arthritis. I know that you've been in your practice focusing on metabolics and skincare and weight loss, but sometimes those patients that come in and they come in with multiple conditions.
Yeah, absolutely. And actually, in the beginning of my career and when I first started practice, I was in pain management. So I saw a lot of patients who had for rheumatology, right? Whether it be osteoarthritis or rheumatoid arthritis. And the biggest thing with that is that in functional medicine, we can give them hope within these conditions. As you were saying, a lot of patients feel hopeless because they're going from doctor to doctor. They're on so many medications. They're not feeling better. Their health keeps decreasing. And so when they come to a practitioner who actually has some tools to be able to utilize and help them, it gives them hope. And then they start to see the improvements. And this is kind of like why I love functional medicine is to not only give patients hope, but also to give them tools and options to actually start to improve their health for them. And that's why this is a really good topic to go into, because there, as a practitioner in functional medicine, and if you're dealing with pain management, you may see some patients or many patients that have rheumatoid arthritis. And it's important to understand with RA that there are varying stages. There's about 5 different stages that a patient might go through when they are dealing with rheumatoid arthritis. And why are we going through these stages? Or why are we discussing these stages? It's important to understand these stages is because you are going to see patients at differing parts of stages within their disease progression with RA. And with functional medicine, we can address all of these varying stages. So let me just go into all of those stages for you so you understand what it looks like. And we'll kind of do this through a picture here. So let's pop up an image of the stages of RA, and this is from the European Journal of Rheumatology. We can see on the left-hand side and on the bottom there, right, you're going to see at-risk individuals and then RA individuals, right? They're going to go into what's considered stage 1. This is what occurs when there's a genetic predisposition and exposure to environmental risk factors, which we will get into, that is going to begin to trigger an immune response. So if you have a patient and they have a family history, right? You look at their intake, they have a family history of rheumatoid arthritis. You want to take a look at their risk factors and monitor this for them so you can help to prevent this from progressing from them, right? Now, the next stage is stage 2. This is when autoantibodies of RA are present, like rheumatoid factor or anti-CCP. This is the marker that is present in blood testing. Anti-CCP, CCP just stands for anti-cyclic citrullinated peptides. This is what you're looking for when you are doing blood testing. Let's say you have a patient who has a family history and they're concerned that they might get they might progress into RA. You can run some tests on them. And what you would want to run is rheumatoid factor, anti-CCP. Those are a couple of markers. There's going to be other markers that are also indicated for them. Now let's go into stage 3. This is what occurs when symptoms like joint pain or stiffness are present, but there is no other clinical evidence of arthritis. This means that by the time a patient comes to see you and they're in stage 3 with chronic pain due to RA, they've already had immune dysfunction and overactivation for weeks or months, and they've already been developing antibodies for a while. So this is important to understand when they're at this point. We want to look at a different type of approach for them. And that's what we'll kind of dive into a little bit more in this presentation for you. Now, stage 4. Now, this is when there is clinical evidence of arthritis in 1 or 2 joints, and this is considered an early undifferentiated arthritis. If these symptoms are intermittent, it's going to be called palindromic rheumatism. And that is important to understand that that occurs within stage 4. And then stage 5 happens when the individual meets all the diagnostic criteria established with RA. And that is all of the stages that we want to consider when you're working with patients who may be at risk for rheumatoid arthritis or already have rheumatoid arthritis. You want to figure out what stage they're in, and you could do that through their intake and through lab work as well. So as I was mentioning, there are risk factors to consider for rheumatoid arthritis. So we want to discuss a few of those risk factors here. In this image, this is going to show a number of environmental risk factors, and these all clearly contribute to rheumatoid arthritis susceptibility. This includes smoking, infections, periodontitis, and that is a dental issue, obesity, and hormonal and dietary factors. These are all factors that we can look at improving for them, except for the dental procedures. Obviously, you're going to be referring them to a dentist for that. But things like smoking, infections, obesity, hormonal, and dietary factors, these are all risk factors that we can help our patients in improving for them. As I was saying, let's say they were in stage 1 or even in stage 2, and they have a family history of rheumatoid arthritis, and they have some of these risk factors. You would want to look at decreasing some of these risk factors for them and improving on some of these issues for them to help prevent the disease progression for them.
And I like that introduction, Dr. Chill, because it gives you an idea of where the patient might be. And as you mentioned, one of the things that is really important to remember is that when a patient comes to see us and they already have the symptoms, that means that the auto antibodies have already been developed for quite a while. So it's important to explain to patients. Patients come to see us and they have certain expectations of resolving this as soon as possible. We definitely had a lot of those patients that would come in and, they hear something good about you as a practitioner, and they want to see if can you resolve this in they expect it to feel better within a couple of months, right?
Right.
And one of the things that we always tell patients is the expectations, everything has to be set up in advance, because that helps us to make sure that we're capable of fulfilling what the patient is looking for, and also set up the expectation that they might have this pain started like last month or 2 months ago, but those antibodies, that chronic inflammation has been there for quite a while. It could have been there for a few months, could have been there for a few years, right? And then the symptoms started to increase slowly to the point when they're like, oh, now I'm actually noticing this every day, that swollen fingers or that, right? So it's important to set up proper expectation with patient, explaining them that it's going to take time. It took probably, 2, 3, 5, 10 years to develop this disease. It's probably going to take time, anywhere between 6 months to a year to see really good results with their health. And of course, we got multiple strategies I'm going to talk about that can together get them there faster, right? But it's good to know the stages and how to explain that to a patient. So let's dive into the first trigger of functional medicine. Dr. Chile already mentioned about the environmental factors. And so we're going to dive into RA trigger number 1, which is air pollutants. So air pollutants is quite a big topic. We got probably about a few hours of presentation about the different lab testing and different biomarkers and how to identify which group of pollutants and the detox process. So it's quite more complex than what we're going to show it today. But what's important to remember is that when we breathe in air pollutants, or we consume them through food, or we consume chemicals through food and water, it triggers an inflammatory reaction. And air pollutant specifically can lead to dysregulation of both the innate and adaptive immune system. And we're going to look at an interesting picture, because we like to show everything very, very visual to make sure that it's easier to understand. So we're going to take a look at this picture from an established published study in the Journal of Environmental Pollution in 2023. And on the top, you can see that the term air pollutant or environmental factors refer to a mixture of gases and particles that are mostly generated by human activities, such as smoking, cars, industry, different types of industries, and agriculture. I'll give you an example. If you live in a city, we're all exposed to car emissions. We're exposed to dust. A lot of those particles are in the air in dust, right? And another example is there was a glass factory here in Portland that had a cease and desist a few years ago by the governor, because they found that it was polluting the entire area in Portland all around the factory, right? So those particles are all around us in the air. We breathe them in, and that leads to, as we breathe them and they come into our circulation, they get into our circulation, our immune system travels and in our body and encounters those foreign particles, right? At that point, the immune system is simply, in simple terms, says, I don't recognize this particle, and start the immune process, right? Now, I'm oversimplifying it, of course, because there's other mechanisms that determine if the immune system will shut down at some point, or will carry on this ongoing and aggressive activity against certain tissues, in this case, rheumatoid arthritis, against our joints. But there's also, we know that there's genetic factors. So some individuals have the predisposition for this condition. There's also the topic of nutritional deficiencies. So, for example, patients that have vitamin D deficiency, they're not, let's say, not exposed to sunlight enough, or they don't get that enough in their food, then they have even higher susceptibility to developing an ongoing chronic subclinical systemic inflammation that eventually what leads to is two things. One is on the right side, in the center, you can see the development of autoantibodies, such as the anti-citrulline protein antibodies and rheumatoid factor, right? So there's different types of proteins that could be our immune system can produce. Now, when we have inflammation, we also have reactive oxygen species, right? The ROS that you see there in that orange mark. Reactive oxygen species are essentially different types of free radicals that cause damage to our tissues. And then, of course, that leads to the more oxidative stress you have, the more reactive oxygen species you have, the more damage you have. Our immune system is sent, more immune cells are sent to the area of damage, and the inflammation increases, right? So that's almost like a vicious cycle that kind of, you can see the release of cytokines leads to an increase of inflammatory cells that leads to rheumatoid factors, right? And the increase of inflammatory cells also increase the release of cytokines or chemokines, such as interleukin-6, which also plays a role in destroying our joints. And that, again, leads to a higher increase of reactive oxygen species. So, of course, we're oversimplifying this, and there's several reasons why the joints are being affected, right? But it's really important to remember that there are multiple factors. We mentioned here a few factors. There are other factors. For example, there's one particular study that showed that dental procedures could, if they clear mercury in all dental fillings, for example, or they do tooth extractions that were infected, can also significantly decrease the levels of pro-inflammatory markers. So that's why it's really important to understand all the little connections, right? When it comes to environmental medicine, it's a very, very big topic. Understand all the factors in our environment that can contribute to that rheumatoid factor, the development of antibodies, the development of those inflammatory cytokines. Learn what are the specific signs and symptoms, and also learn about the treatment strategies and the lab specific biomarkers, which we do because we're focused heavily in our program on the clinical application. So that's the first factor that we want to talk about. That's the environmental, right? And there's multiple strategies how to reduce environmental exposure. You can have a HEPA filter. That's a HEPA filter. That's a filter that essentially circulates air through a certain three-phase filter that clears a lot of those particles. There's some interesting studies and reports that show that with running a HEPA filter, you can significantly reduce the exposure to air particles, air pollutions. And then, of course, if your patient works in construction, in a metal factory, in any type of occupation that could expose them to more of those air chemicals, air pollutants, then it's important to make sure that they take appropriate precaution, right? So this reminds me, I had a patient once that uh, had a lot of joint pain, and her physician thought that she's got arthritis, but she didn't have her labs did not match exactly the clinical presentation of rheumatoid arthritis, but it was definitely, that presentation was definitely there. She had bilateral swelling and pain and all that stuff, and she came to see me. She was quite frustrated. She was taking different types of medication. She was quite frustrated. And I asked her, what do you do for a living? And she said, I work in a nail salon, right? And it was really interesting because I started to suspect that all those chemicals that she's breathing in the nail salon and the hair sprayers that they're using in that salon could be impacting her health. So we did some lab testing. We looked at different markers. We supported her where we needed to support her. And then the real breakthrough came in when she went out on vacation away from the salon. She went out and she spent some time with family, and then she spent some time at home during the holiday, and her pain significantly reduced, right? While she was still on the same protocols. So this is just an example of understanding that using drugs or using supplements or using natural solutions instead of drugs, we have to understand what's driving the patient's disease or contributing to it, because if we don't, they keep stimulating that, they keep flaring up that situation, right? It's just counterproductive. So I do believe that the reason why the anti-inflammatory protocols that I put her on worked so fast once she was not at work was because, and she said that within the first few days of not being at work at all, she started feeling so much better. Like just on the 5th or 6th day of not being at work, exposed to all of these hairsprays, nail chemicals, all of that stuff, while being on anti-inflammatory protocols, she started feeling better. And it was significant. Like she came to see me 3 weeks later. It was quite a significant change. So all of this work went way better when we understand the root cause. So Dr. Chill, take us into the second factor, which is also very, very important, and we talk about quite often.
Yeah, absolutely. So if you have been listening to us and been with us every week and listening to these podcasts, you know how important the microbiome is to overall health. And it's no different with rheumatology and our joint health, because this is a major contributing factor to rheumatoid arthritis, is changes in the gut microbiome. So I want to explain how this actually all works. And it looks like there was a student that asked if there was a specific kind of bacteria that was correlated to rheumatoid arthritis. It seems like you were very intuitive with this, because we will be going into that question within this section here. So let's talk about rheumatoid arthritis. We all know now that it is a chronic autoimmune condition, right? This is going to primarily affect your joints. And then there are microbial infections that is considered a crucial inducer of rheumatoid arthritis. There's numerous studies that are highlighting a critical role of the gut microbiome and the health of the gut microbiome and rheumatoid arthritis. What this means is that when there is an imbalance of the gut microbiome, whether it be with a deficiency of healthy or beneficial microbes versus an overgrowth of microbes, this can lead to a pathogenesis, and it mainly produces pro-inflammatory metabolites. It impairs the intestinal mucosal barrier, and then it can cause molecular mimicry of autoantigens. And this is what can cause the pathogenesis of an autoimmune condition. So let's take a look at how this works. And the best way to do that is through a picture. So let's pop up this image here. Okay, so this is a very complex image. So I want to break this all down for you. This is showing the gut microbiota and the pathogenesis of RA or rheumatoid arthritis and the effects of RA, including therapeutic drugs and the gut microbiota. So we can see here in section A on the top left there, this is going to show that there are changes in the composition of the gut microbiome, and this occurs at different stages of RA. This is another important factor why we went through the different stages of RA. What happens is levels of Prevotella and lactobacillus are increased. This is going to the student question that was asked. And this can happen at the early stage. And then an abundance of lactobacillus, Collinsella, and Akkermansia is increased, while that Haemophilus species is it decrease, and this all occurs in the active RA phase. So we understand that there are certain microbes that are beneficial for preventing RA, and then there are microbes when they are decreased, such as the Akkermansia and Haemophilus and the lactobacillus. This can be shown to be activating in RA. Now, in section B, this is going to go into RA treatment drugs, which can improve gut microbiome imbalances, and this can actually relieve the symptoms of RA. This includes methotrexate, which we see right there, and others. This also includes traditional Chinese medicine. And this has been shown that when these medications improve the gut microbiota, some of the symptoms of RA will improve. Now let's go into section C on the right-hand side there. Here we can see how autoimmunity is activated. So the gut microbiome, this can lead to damage of the epithelium and to the opening of the paracellular pathway. And this can cross the epithelium and get in contact with the immune cells. This all happens beneath the epithelial layer, and this can lead to inflammation. What happens here is bacterial antigens will promote an activation of autoreactive immune cells. This is your B cells and your T cells. This all occurs in your lymphoid tissue. This results in an imbalance of regulatory T cells and T helper 17 cells. This all causes an expansion of an inflammatory response, which activates B cells to produce autoantibodies, right? This is your anti-CP antibody that we were mentioning earlier and the rheumatoid factor that we were mentioning earlier. And these are some of the markers that we test for. So now let's take a look at section D and how the imbalance of a gut microbiota can trigger the migration of autoreactive cells. This migration of those autoimmune cells, this is what goes into the joints. This is what can cause cartilage and bone damage. This is when you start to have the severe symptoms associated with RA. And how does this all occur, right? So one, the bacterial antigens will trigger and promote inflammation in the synovial membrane. This attracts the leukocytes into the tissue. We see that on the bottom left picture there. Two, there's autoreactive cells. These are going to activate macrophages, and this results in inflammatory cytokine production as well. And then three, the cytokines are going to induce fibroblasts. This is going to produce MMPs. MMP stands for matrix metalloproteinases, and then rank L genes, which is receptor activator of nuclear factor kappa B ligands, and these all mediate destruction of the bone and cartilage tissue, and this is what leads to the development of RA for our patients. So this was a pretty complex picture, but this was the progression of everything from the microbiome and how it can trigger the autoimmune response and the cytokines, which goes into the synovial fluid, which leads to the development of RA.
Yes, and I'm so glad that you brought up this particular study, and because there are different types of mechanisms, and this is one of the major ones, right? We know that there's there's these types of triggering mechanisms. There's also molecular mimicking. There's different types of reactions. While this one is more on a functional medicine specific side, there's also molecular mimicking, which is a combination of functional and nutritional medicine, because it's a response typically to foods. But that's really why we work when we teach functional medicine. We teach the clinical application of functional medicine together with nutritional medicine, and of course, if if you know herbal medicine as well for each condition, like we're going to discuss right now, then you also have additional powerful tools for each condition to help your patients to reduce inflammation, restore their health. So that's a big part of why it's so important. And I know that Dr. Chill, you've been running our Quick Start program and doing the coaching with multiple practitioners, and from physicians, nurse practitioners, nurses. We have also a lot of PAs, pharmacists, even physical therapists and other healthcare practitioners who are joining. And how does it work? Can you share a little bit in terms of the coaching calls, the case studies? How does that work? How do they learn about the clinical tools?
Yeah, it's actually one of my favorite things to do is to help practitioners with growing their clinic, right? Both from a clinical applications part and then also from growing their business side. And what occurs is each practitioner in the program, they have access to these coaching sessions as often as they need, right? So a lot of practitioners will use these coaching sessions either to help them with cases that they're working on, right? And what they'll do is they'll utilize tools such as the functional medicine health survey. They'll have their patient fill that out. They'll send that in and set up a coaching session with me. I'll get that functional medicine health survey, and then I will help guide the practitioners on how to use that functional medicine health survey in determining what is their contributing factors to their conditions, their symptoms, and then we can use that to also figure out how to prioritize their lab testing. And then from there, what are the resources within this program to start to come up with treatment approaches for that patient? And then at that point, they're put on some sort of treatment protocol, right? While they're waiting for their lab results. And then a lot of times practitioners will send in lab results for those coaching sessions as well. And then I will help guide them through those lab results as well. And so the whole point of that is to ensure that practitioners feel really comfortable utilizing the functional medicine approach in their day-to-day and in their clinical setting. As Dr. Cohen was mentioning earlier, right? A big part of being a practitioner is setting correct expectations. And if you're kind of new to functional medicine, you might not know how to set those expectations, especially with supplements or certain protocols or certain lab testing. That's why these coaching sessions are so important in the clinical aspect to kind of discuss all of that with me, because I will go through all of those case studies with every single practitioner. And as I was saying, you have access to these coaching sessions as long as you're within this program. And I think, Dr. Cohen, it's even 2 years after their program as well, correct?
Yes, and currently this month they're getting a bonus package that includes 3 years of mentorship, coaching, and we like to show them all of them for the initial stages in the program. So we used to think that you have to complete your entire certification program, learn about everything, including the specialty classes, which this would be considered sort of a mini specialty class, right? Where we dive specifically into RA, but we have specialty classes on autoimmune conditions and women's health conditions, men's health, geriatric conditions, cardiometabolic, like weight gain. Those are problems, real problems that providers, they struggle with, and patients struggle with in their practices. In providers struggle with treating those, and patients struggle with getting care for. So doing the coaching sessions with you is really allowing them from their first few weeks in the program to consolidate all of that root cause through a case study, right? Like really learn all of this through a case study. They can also use themselves. I know that some practitioners that did coaching we do use themselves as the patient and filled up we have the evaluation form that they fill up in a digital form. And then you show them how to use the quick start guide, right, and all the other treatment protocols that we have. So that's an amazing learning experience. And for our community members, we also have the ongoing teaching, like we do right now, these discussions. So we have this ongoing teaching. And then we also have additional tools, like we got marketing tools to help them grow their practice, which is really important, right? One good strategy can add another $5,000 to $10,000 to your monthly revenue, right? So all of those, and then of course we have the phone app that is coming out very soon, which will have all they gotta do is just type in the condition like diabetes. It pulls up all the treatment strategies, right? So they'll have all of that as well. So that's gonna be included in this month's bonus package. So this is where we're gonna redirect into natural solutions. It's really important for all of us to understand what options can we consider for patients who are maybe on medication and they keep struggle. Maybe they're not on medication, they don't want to be on medication, and they got this chronic inflammatory presentation. So the first one we want to talk about is very well known compound, which is curcumin. It's the active component of the traditional Indian spice turmeric. And curcumin has been studied for years for its anti-cancer, antioxidant, anti-mutagenic, anti-inflammatory. And it was very specifically for rheumatoid arthritis. There was a study that it was randomized control study, pilot study, that assessed the efficiency of curcumin with active RA patients. And they found that 500 milligrams per day for 8 weeks led to a significant improvement in disease activity score and the American College of Rheumatology score. So the typical dosage would be, the dosage they used in the study was 500 milligrams. But we have seen it sometimes with some patients, they'll need 500 milligrams twice a day when they wake up, before they go to sleep, to get a stronger response. Of course, for other conditions, we have seen different dosages and different time length, but this is very specific protocol for RA. And this is coming from the Journal of Phytotherapy Research. So you can look into that if you want to read more about the details of the study. And so that's one of the compounds that we would want to use. Just as a side note, while this particular study have used this for a length of 8 weeks, most clinical studies would be at least 3 months, right? And I would typically recommend to have patients on this for at least 4 months to start seeing some real meaningful positive changes, right? And it, again, depends on the patient, depends on what other medications they're taking, depends on their unique situation. These medications will not address the root cause of arthritis, rheumatoid arthritis, but it is a great natural alternative solution that can help to further reduce that inflammation, right, and chronic pain. So that's something to know. And Dr. Chill, take us into the second compound.
Yeah, so this compound is called ginger. This is another spice or an herb that can be used with rheumatoid arthritis. And this is part of the rhizome, and it's the plant Zingiber officinalis. And this is native to parts of Asia. And ginger, as some of you may be aware, this has been used in traditional Chinese medicine for some time now, along with Ayurvedic medicine for centuries. It dates back all the way to the 1500s. It's known for its potential support in various aspects of health, including anti inflammatory, antioxidation, antimicrobial properties. And it's been shown what they did with ginger was they did a study to to figure out the effects of ginger on inflammation, in particular for rheumatoid arthritis. And what the results of the study showed was that consumption of 1,500 milligrams daily for 12 weeks led to a significant reduction in disease activity score and a reduction in inflammatory cytokines. Remember, we were discussing the mechanisms of rheumatoid arthritis, and there's an influx of inflammatory cytokines. So ginger has been shown to help reduce those inflammatory cytokines. And if you want to read more about that, the article is called "The Effect of Ginger Supplementation on Some Immunity and Inflammation Intermediate Genes Expression in Patients with Active RA." And it got really dark here really fast. We are getting into fall season here. I'll need
Yes,
to make sure I have a light here next week.
fall season in the last 30 minutes.
Yes. It got
That
dark
happens.
really quick.
Yeah, that happens in Portland all the time. Yes. So these a couple of clinical notes that I wanted to mention with those supplements. One, combining those compounds. There are some interesting studies that show that combining those compounds together in many cases could be much more beneficial because each one of those compounds might have different mechanisms, right? So, for example, when we go through functional immunology, we learn very specifically about what's the mechanisms of each one of those, right? So omega-3 has a completely separate mechanisms of how it reduces inflammation, right? Ginger, boswellia blocks different enzymes, right? And curcumin, for example, reduces IL-6, inflammatory pro-inflammatory cytokines IL-6, while elevating IL-10, which is anti-inflammatory. So it's really helpful when you actually learn about what are the specific mechanisms of each one of those 8 or 9 or 10 different compounds that we teach in the program, because you can fit the right compound to the right patient. So we want to go from just general concepts like we hear of or read or learn here, right? So, oh, you got inflammation, you got RA, great. Here's a couple of good studies. Here's a couple of strategies. Curcumin in a specific dosage, and then ginger in a specific dosage, right? But as you learn more and more the functional and nutritional medicine approach, you want to get more comprehensive and more specialized knowledge in terms of like, okay, let's figure out what works best for you, right? Because customizing and personalizing the treatment strategies based on each individual biochemical needs is always going to work way, way better. And I say that just out of my own clinical experience and also coaching. We've had hundreds of practitioners go through our programs at this point. But even years ago, when I switched from general statements to patients like, oh, take this and this and this, and I had good results. But once I learned more and more and more about the mechanisms, how each one of those nutritional medicine compounds work, I started understanding that I can make specific recommendations. So for this patient, I'll go with omega-3 and boswellia because it impacts these enzymes, right? Or for another patient with arthritis, I might go with something different, right? So, and I started getting better and better clinical results, right? So that led us to better reputation. We started getting dozens of 5-star positive reviews. People talked about us. Your clinical skills is your best form of marketing. Of course, when you first started, we have systems and tools to help you to accelerate your practice growth, but it's like no marketing in the world can compensate. Even the best marketing in the world cannot compensate for lack of really good clinical skills, right? And I'm sure all of you would agree with me. So that's where we're here. That's where we learn. We keep learning and advancing. If you are in the functional medicine program, we got students from different programs that are watching this today, but if you're in the advanced and clinical practitioner program, make sure to reach out to Dr. Chill for coaching. This program, what I'm talking about, is the comprehensive, clinically focused. We have a comprehensive lab analysis review from all the foundational all the way to the very advanced lab testing. We got nutritional and supplements. It's all self-paced, 100% online. And we also have a lot of practice building to help you out. So our goals is to continuously improve your clinical results. And if you choose to, also help you to increase your income and revenue, like we have done for so many of our practitioners in our community. So with that being said, I really want to thank all of you for being here, for continuously growing your skills, for investing in yourself, your skills, your patience. And I want to thank Dr. Chill, who has taken time to prepare for this and for sharing his clinical experience. And I also wanted to thank our media team and Jacob, who without them, we could not have been here with you wherever you are. So I really appreciate it. And take care for now. And we'll see you in the next class.